Hi, Dr. Moore. Can you tell us why the community status is now changed to green and what that means?
So there's a number of different metrics that we monitor to assure the community that we should be in green at present. So number one is how many tests are done, and on average we're getting around 400 tests done a day. So thank you to our community that continue to get tested. The percentage of all of those tests that are positive is exceptionally low at 0.13. For context, the provincial rate of positive tests is around 2.1. So we're very, very low positive rate, and we still have good testing time. The turnaround time from our labs is again brilliant. Around 90% of our tests are back within 24 hours. The public health response, we are calling anyone that's positive well within 24 hours. Our hospital has no patients in the intensive care unit or in the general medical wards as a result of COVID-19. We had a couple of outbreaks that we were monitoring. One was in a long-term care facility. That finished yesterday, and there's been no risk of spread in that facility. And we had a couple of cases of children with COVID-19. The 14-day observation period for all their contacts is over, and that finished today. And we had no transmission in those settings, which is great. And our rate of cases per 100,000 per week remains very, very low at around 1.9. So all of this good data is telling us that we're back into a green status and that our community's done brilliantly at lowering the risk of spread of this virus by adhering to all those best practices of hand hygiene, wearing a mask in public, physical and social distancing, staying within your family household. And so we've gone through a number of small waves. So this was the beginning when returning travelers had COVID-19. This was secondary to a workplace outbreak. And we had a rise in cases as we thought, as children went back to school and we had students back in our colleges and universities. And that number is now going down. So we're back down to a low risk environment, and hence the reason that we're going to be in green. I hope we can stay there for a couple of weeks, and our goal will always be to be able to rapidly suppress if COVID tries to enter into our community by having all of these things aligned. Good testing rate, a community that embraces prevention and then testing, good laboratory turnaround time, and good public health response. This will continue to keep us in a very good position as we head into winter and people going indoors. So you will hear from us. We'll probably go from green to yellow. My goal is, as a community, never to go higher into orange or red, but to stay undulating where we can control the risk of COVID-19 in our community. Our community's done brilliantly. I thank them very much for adhering to all the best practices, and congratulations, we're back in green. We can't do this without a brilliant community that adheres to prevention as the key strategy.